Hello and welcome into the Psych with Mike Library. I am Dr. Michael Mahan, here as always with Mr. Brett Newcomb.
Hello.
We were talking about, in real time, it is summer for us, and we were talking about that at some point we are probably both going to take a vacation, and what would that mean about logistics for doing recordings and things like that. And you had suggested, what?
Getting a substitute for me.
Yeah.
But not for you.
I hear everyone in the audience saying, no!
Well, yeah, of course.
Yeah.
Yeah.
I think people like you more than they like me.
And I know why.
You've always known why.
Yeah, well.
So we won't do that. We will figure out how to make sure that we have fresh material for people every Friday, no matter what it takes.
Yes.
Yeah.
I actually went to lunch last week with one of our former colleagues and one of my former students who said that they listened to a random selection of our podcast and that they felt like they were back in a staff meeting from years ago at West County Psychological. So they didn't find it to be particularly
helpful?
Essential for their life to continue to listen to them.
Oh, really?
Yeah.
Oh, well,
because they had already gotten tired of our conversations.
I was going to ask you who that was, but now I'm not going to.
I think you'd probably be happier if you didn't.
Because that hurts my feelings.
Well, it wasn't Dr. Fitzgibbons.
Yeah. Well, I don't think she's ever listened to anything.
I don't know, but I certainly wouldn't say anything bad about her.
No.
Yeah.
No. She could ruin our careers.
Don't go there.
Okay. So we had in the past done an episode on the efficacy of antidepressant medication.
Right.
And what the foundation of that is that we presented a lot of evidence that in the biology of it, that as you get more severe depressive disorders biologically, that antidepressants become more effective. But in the most mild of the presentations, that statistically they tend not to operate any better, and in some cases not as good as placebo.
Yeah, the question is it a subjective experience or an objective one that we can measure and identify? And so where we started this conversation was talking about, we know people who are seriously clinically depressed, struggle with suicidal ideation, with the belief that they or their lives are not of value to anyone, including themselves. And it's a horrible burden to carry if you feel that way. And it's a horrible burden to care about someone who does feel that way, whether it's as a clinician who's responsible in some ways for them, or a partner in their life, a member of their family. And so we talked about it, and we said, well, what can we do? What is being done? What's out there? And we covered a number of new strategies that are unfolding as brain research gets better, and we get a better definition of what biologically is involved in depression. And part of our discussion didn't involve at that time, but today we're going to talk about it. Is it just a placebo effect, and does that make any difference? Should you take antidepressants? One of my friends who's pretty seriously depressed, or has been in repetition, they go through severe depression, they get better, they go back through severe depression, they get better. So they're tired of riding the roller coaster, and they were talking to me about antidepressants, and they said, they don't work. And I said, well, what's been your experience with them? What have you taken? How long did you take it? How much did you take? And they didn't really have an informed answer. They just had a bias that this doesn't work.
So this individual has a recurrent depression and had been prescribed antidepressants, but was at best sporadic in
Yes,
being
or they didn't have the patience to wait it out to see if it would help. Because they take it, it's like you take a sleeping pill and you sleep tonight. You take a headache pill and your headache goes away this afternoon. You're taking a depression medicine for the first time. It's going to be 11 to 15 days before you feel anything, and you aren't going to feel like dramatically better. You're just going to feel less depressed, and that's hard to measure because it's a subjective interpretation.
And that's one of the things that I have always said to people is that if an antidepressant works, you, the client, will never know it because it's so subjective, and
How do you describe a
you live in
negative?
your own
Right.
well, you live in your own skin, and it's
Yeah.
like, oh, when you have a child and you haven't seen somebody in 5 months, and they come over and they say, oh, your kid's so big, and you
Yeah.
say, no, they're the same
It's
size they were yesterday.
Same as I saw him yesterday.
Yeah, and because you live with it every day, you don't notice even those gradual improvements,
Well, that's
and
part
so
of
you
what
have
we
to look
do in
at from the
therapy is
outside.
challenge them today. Like, did you have trouble getting here today? Did you miss any work this week? Were you able to sleep all night, 3 nights in a row? What is different, because they're really struggling to be able to identify any progress.
Right.
So.
And so I tell people, you have to look outside. You have to pay attention to, if somebody in your life says, wow, what's different? You seem like you're in a better mood.
Lighter.
Pay attention to that.
Yeah.
Because that's how you're going to know if it works. You're not going to recognize it yourself. Now, in some cases, you absolutely may recognize it yourself. I'm not saying that's never happened. But as a rule, if
But
they
it's when you
work,
feel more oppressive. The absence of feeling oppressed is hard to get a snapshot of. But suddenly, if you wake up and you feel oppressed, then you're like, yeah, I got this again. Like my friend, and clients that I've had through the years who were similar to my friend, that would go through waves of being really depressed and then waves of being not so depressed or even better. And I always encourage them, whether they're on medicine or not, because the first thing they want to do is come off the medicine. This doesn't work, or I don't want to have to take it forever. What does it mean about me? And is that a sign of weakness, characterological or moral weakness, that I have to take an antidepressant? And they really resist that. I don't know where that messaging comes from, but historically, that's what my patients have said. And I always tell them, even if you're not on medicine, you need to have a good support system, and you need to have the ability to have somebody say, I think you're slipping. It's been 3 days since you've done anything besides watch television. Let's go out to dinner. Let's go for a walk around the block. Let's play badminton or ping pong or tennis or something that isn't sitting and watching television. And you're like, no, it's not. I'm tired. I'm just tired.
right.
And
It's not depression.
yeah, it's not. It can't be depression. But you need a support system that can identify those changes, and then you need to listen to them. And when they say, okay, I think you're slipping, I think we're in trouble again, let's go to the doctor, let's go to the therapist, maybe resist that a little bit less.
But what brought this to the fore, at least for us today, was that you had sent me a couple of days ago, and is it Aeon or Eon?
Yes.
Yes. Okay. Aeon,
Aeon,
which is a website on the internets that does a lot of really good publication and seems to have some credibility as far as the people who write for them and the people who provide the information.
They
So we
reposted
like
this
it.
article today because they said it was the most read article from last week.
Are you kidding me?
No.
Oh, okay.
Why would I kid you?
Well, because that's how you are.
But the article's entitled In Defense of Antidepressants, and it's written by Vasco M. Barreto, who works in Portugal at the Nova Medical School. And depression is not his specialty. He's a biologist.
But he had experience with depression himself.
Yes, yes, he's suffered from depression, and so he wanted to do some research on whether or not antidepressants do anything positive for people, have beneficial outcomes. And he started looking into it, and the results that he found, just a synopsis of them, is that for major depressive disorder, people that are seriously clinically depressed, severely depressed, that antidepressants are generally accepted as doing good things, beneficial things to help, if you get the right medicine and you stay on it. But that for lesser or less intense forms of depression, that there's kind of a all over the ballpark opinion about them. And his recommendation, and if you read through the whole article, which he does a great job of evaluating all of these thoughts and trend lines in the research, he says, even if it's a placebo, what difference does it make? If you are mildly depressed, or depressed enough that a physician says, or psychiatrist, which is also a physician, says you need to be on this, it'll help you, that you should get on it, and that you should not fight it. You should take it. Now, you need to have information about what are the potential side effects. Are there some that are more or less damaging to me and my lifestyle? Some that I would want to avoid. For instance, a lot of the antidepressants also suppress your libido.
Mm-hmm.
And so if you're on those medicines, you're not going to feel sexual arousal or sexual
Right.
responsiveness, which could cause problems in your relationship.
It is the number one reason for med non-compliance with antidepressants.
According to the research.
Yeah.
And the conversations that we've had. But there are a couple of antidepressants that are out there
Mm-hmm.
that don't have that side effect. And if those happen to work for you, then God bless you. Get on them, stay on them.
And there are a lot of new medications that are coming online. The esketamine drug that's going to be put out by Johnson & Johnson this year. There are some other new drugs that are based on glutamate, which is a different neurotransmitter than the serotonin, norepinephrine, traditional kinds of neurotransmitters that are affected that don't have that side effect profile.
And this article goes through those. It talks about the development of the monoamine oxidase inhibitors, the MAOIs, and then the evolution into tricyclics, and then the evolution into SSRIs, and it starts to discuss glutamates and other neurotransmitters that they're looking at as, would this have an impact?
Right. And that's obviously, what I love is that biology of it. So I was really, really impressed.
But it was written for a layperson.
Yeah.
You don't have to know all about biology and neuroanatomy that
Right.
in order to understand what this article is saying.
But, we wanted to revisit this because we wanted to say that this article is essentially saying everything that we said. Yeah. That in the severe forms of depression, these antidepressants are shown statistically to be vital for individuals, that they can make the difference between, even not joking, life and death for individuals who are severely suicidal. In the less severe presentations of depression, they're kind of a mixed bag, and sometimes they work and sometimes they don't. But that what we are saying is the same thing that the article is saying, which is, but if you're going to go the medication route, then go all in and really make a commitment to that, and don't just be lackadaisical in the way that you take the medicine, because it takes usually about 3 weeks for a chemical antidepressant to do what's called titrate. That means it gets a level in your bloodstream that is therapeutically effective. And so if you take it for a week and say, I don't feel anything, then you haven't felt anything, because the medication hasn't become effective yet.
Right.
Yeah.
And then if you decide this particular one doesn't work for me, it's going to take a couple of weeks for that to all get out of your system, and then you have to start another one. So it could be 5 or 6 weeks before the second one or third one or fourth one works. But the point I want to make is keep trying. Don't try one or two and say, they don't work, because they're different, and they work differently in different people. People metabolize things differently. And so don't give up hope. Just keep, work with your doctor and say, all right, this one is not working, or I'm having these side effects that don't seem to be livable for me, so I want something else. Is there something else out there?
Mm-hmm. And what I want to really, really reinforce for people, and obviously this is self-serving, but I genuinely believe it. Don't just go to your psychiatrist. Make sure that you are also seeking some good talk therapy.
Yeah, because most psychiatrists don't do it. They
Right.
do medicine. And some of the ones that we know have good therapists in their office, and so there's a sort of a package approach. You can see the doctor, get your meds regulated, and you see the therapist at the same place. But if not, they'll recommend or encourage you to go see a therapist that you think is good for you.
Right. And all of these medications that we're talking about have, as a part of the package insert, a line that says this medication should be used in concomitant, so that means with talk psychotherapy. So the medical community itself recognizes
The value.
that talk psychotherapy is at least as important as the medication itself. So the medication might get you 33% of the way to where you want to go, but you still could have better relief from those depressive symptoms if you are also in talk therapy.
And hopefully talk therapy doesn't have any of the negative side effects.
Hopefully not.
Hopefully.
I've never been told that it does, but...
Well, but you wouldn't recognize it. They talk about the cost. They talk about the inconvenience. They talk about the embarrassment.
Yes, that's sure.
They talk about, I don't see why, talking about my mother 20 years ago isn't helping me not be depressed today. But it may be what's involved.
It may absolutely be, but the thing that is most important is what you and I always go back to, which is the presentation of that safe holding environment that is non-judgmental. And I guarantee you, anybody who feels depressed feels like they are not understood by the majority of people in their life. And they feel like they don't have a place where people really are non-judgmental.
It's hard to be non-judgmental because you don't see a visible reason. Like if somebody was walking on crutches or had their leg in a cast, you could say, "Oh my gosh, you hurt your leg." But somebody's just depressed. The natural tendency of so many of us is to say, "Well, get your butt in gear, get up and do something. Shake it off."
And to be
Which
honest,
is easy to say. It's hard.
yeah, it is. It is easy to say, but to be fair, we're also though going to say that with a depressed person, get out of bed, take a shower, brush your teeth, do small things,
But not in the same dismissive
No,
way.
not
We're saying
in-
that
not
because
in a
we know
dismissive
the
way at
steps
all.
to recovery,
Yes.
steps to improvement involve being busy. We will say to somebody, get involved in somebody else's concern. Go work at a food pantry. Do something for somebody else. Find an old lady in your neighborhood, a widow lady, and cut her grass. Do something for someone else. Refocus your attention so that you're not staring at your own navel saying, "Woe is me."
And for me, that is so incredibly important. You hear all the time this kind of even dismissive catchphrase, "Well, love is the answer," right?
Yeah, what does that mean?
And Oprah says it, and people say, "Oh, well, Oprah says love is the answer." But then when they think about it, they're like, "Okay, so how is love the answer?" Well, love is the answer because when you think about school shootings or you think about mass shootings in general, what is the common theme? People say, "Oh, well, those people are bullied." That's not true. Not every person who's ever been a school shooter or a mass murderer has been bullied. That just isn't statistically accurate. But what is true is that every single person who's ever committed those acts feels dissociated from other people in their environment. Dissociation is the foundation of depression. The more that you can get yourself connected either to people in your environment or people in your community is going to reduce the amount of depression that you experience and is going to make you feel better.
And it's one of the reasons that 12-step programs have the success that they have. If you go to a community that shares your concerns, I mean, it can be damaging. You can go to a group, a 12-step group that's invested in helping each other stay sick so that the group stays together. But you can also go and get some support and some encouragement and some understanding. Yes, I've done these horrible things and I'm still here. And there are people that say I have value. So I would say to you, even though you feel that you don't because you've done these things, I think you have value, and I'm sure there are other people that will think you have value if you let them see.
And I believe in 12-step groups very much, but even if they are meaning to be helpful, they can be damaging.
Yeah.
I was in a meeting once, and there's this guy there that was 40 years sober and was a really, really wise man and somebody that everybody looked up to. And there was a kid in there who was 18 or 19 years old who had really been struggling. And he had been coming to this meeting and had been there several times and had talked about that he just kept on relapsing and he just couldn't stay sober. And he came in one night and said, I feel great and things are really starting to turn around. I went to a doctor and I got an antidepressant. And this 40-year-old, this guy who had been sober for 40 years, just tore him apart and said, "That's a drug. If you're taking that, you can't possibly be sober. You better stop that." And that was absolutely the wrong message. Now, the guy meant it in a sincere way. He thought that what he was saying was productive from his perspective, but it was horribly destructive to that young man and that young man's sobriety.
Yeah.
For some people, the only thing that's going to keep them sober is taking an antidepressant. And that's one of the things that I think that hopefully the 12-step community has become better
More sensitive to that,
is
yeah.
accepting that that's okay.
Well, there's some preponderance of the 12-step community has always argued that therapy is unnecessary and is an addiction in its own right. And that if you're going to get strong, you just have to do the 12 steps of their particular focus and not do anything else. So
and religions are the same way. I mean, I love religion and I am a very religious person, but I taught at, and you taught at there as well, at a university locally, Missouri Baptist University, which you had to designate a faith statement to be able to even teach there. And if somebody, I was teaching substance abuse there, and if somebody wrote to me in an essay and I said, hey, how would you treat this person? And they said, I'd send them to see a minister and they'd accept God and that would be the answer. I had to be okay with that. And from my own professional orientation, I'm not okay with that. I believe that psychology is beneficial even in the context of religion and even in the context of 12-step programming. I think that you can't ignore the biology of being human just because you ascribe to one of those disciplines.
Well, I mean, segue into a totally different conversation.
Yes.
I've always maintained
we always do.
Those clients who have a religious foundation in their life, or spiritual foundation, if that's a better way to say it, have a strength and a resilience that helps them get better.
I agree.
Than the people who don't have a spiritual foundation to their life, whatever the spiritual focus of your life may be. So if you can have it and if you can use it, it can be very supportive and helpful. If you don't have it, you can still get there.
Right.
But it's a harder journey.
But what I don't want is for either a 12-step program or a religious affiliation to say to someone, hey, you know what, don't go and take an antidepressant because you don't need that. All you need is God, or all you need is this 12-step group. Sometimes you do need it.
Yeah.
And it's okay to need that. And I think our message is, if you decide that that is something that you are going to try, that you actually invest in it. Don't just give it a half effort. You have to really pay attention to being consistent with the medications. You have to really give them a long enough opportunity to be effective.
And work with a physician to make sure that you have the right one.
That's right.
If you can find the right one.
That's right. And so that's a great point. Don't be afraid to try several.
Yeah.
And that isn't failure. If you have to try more than one, that isn't failure.
Yeah, because depression is not a characterological failing.
Right.
It's a medical issue.
Right. And it can be debilitating.
Right.
Well, hopefully this was beneficial for people. If you want to get a hold of us, you can subscribe to the YouTube video. There's an icon, a Psych with Mike icon in the lower right-hand corner. You can click that and subscribe. Please like the video if you're watching us on YouTube. You can contact us through the website, psychwithmike.com. If it's Friday, it's Psych with Mike.